Thanks.
Thanks, please.
Thank you.
Good morning.
Good morning.
What can I do for you today?
I'm here for my pap test.
Great. Thank you for coming in. The cervical screening program has now changed. We're no longer using the old pap test, and we're now using the new cervical screening test. The new test is more effective and just as safe as the old pap test. And from your point of view as the patient, the experience is exactly the same. So a little bit about the new test. The new test looks for HPV, the human papillomavirus. We know that some types of that virus can cause cervical cancer. And so the new test gives us a very good chance of picking up your risk, if you have any risk, well before any cancerous changes develop. And then we can manage that risk very effectively. We expect to get the results within 2 weeks' time. If the results are normal, your next cervical screening test will be due in 5 years' time.
Wonderful.
If the results need any follow-up, we will contact you to make the appointment. So this is what we're going to do to get the sample for the cervical screening test. I'll use the speculum, which I will put into your vagina, just here, and I'll open it a little bit so that I can see the cervix clearly. So your cervix looks something like that. And I will use one of these brushes just to put it in and just sweep it a few times. And then I will use another brush in the same way, just a little bit. And then the samples that I collect will go into the liquid in this medium, and the lab will be able to examine it. This is not supposed to feel painful for you, but if you feel any discomfort or if you'd like me to stop, please let me know and I'll stop. Okay, great. So your results should be ready in 2 weeks' time. And so the results will be going to the new National Cancer Screening Register. So the new register is going to replace the old pap test register. And the new register is going to provide an excellent safety net for all of your cervical screening results, and it will ensure that you will be on the right pathway to follow up with any tests or investigations in the future.
I'm a bit concerned about confidentiality. Can you tell me a bit about that?
Sure. So your details will always be kept confidential. The register will ensure that your information is only available to you, to your health practitioner, and to the laboratory that performed your test. The public health programs in Australia will have access to the information, but individual information will not be disclosed. It will be de-identified, as we call it.
Do I have the option of opting out?
Yes, you do have the option of opting out of the register, but you need to be aware that if you do, you will not be receiving the reminder letters to screen when you're due, and your health practitioner may not be able to track your past results. That means that you may miss out on the right follow-up when you do need it. So we recommend that people join and stay on the register.
Okay.
If you choose to opt out, you will find the information on the register website on how to do it.
Thanks very much for letting me know.
Okay. Do you have any questions?
No?
Okay. Are you happy for us to proceed?
Yes.
Okay.